One important aspect of health that comes up in almost every Quiet the Diet podcast episodes is the relationship between our gut and our brain. We refer to this oftentimes as our gut-brain axis. And for a long time, we've understood that IBS symptoms are related to the stress that we experience. I'm so excited to talk to you today about today's podcast sponsor, Nerva. As you all know, I'm on a mission to share any whole body strategy to help manage and, when possible, reverse chronic symptoms that I've seen work in my client population. Both my clients and also our amazing lead dietitian, Nikki, have experienced tremendous benefits from Nerva. Nerva is a gut-directed hypnotherapy app, which means that while you're at home, you can listen to hypnotherapies that are specifically designed to help manage IBS symptoms. This mobile app has helped over 100,000 IBS patients address the miscommunication between the gut and the brain. Gut-directed hypnotherapy has been proven to work just as well as the low FODMAP diet in managing IBS. Our goal with our clients is always to reduce the need for long-term elimination diets and provide any strategy that might be supportive, that's low risk and high efficacy. And that's just what Nerva is. So with their 6-week program of listening to gut-directed hypnotherapies from an app right from your home, they've seen incredible success in reducing IBS symptoms. Instead of targeting stress from a meditation perspective that's more open-ended and not as targeted, Nerva has carefully curated and crafted these research-driven hypnotherapies to specifically target IBS-related, nervous system-related symptoms. As a Quiet the Diet listener, you are eligible to have a 7-day free trial of Nerva, which you can see down in the link below. I couldn't recommend Nerva more for our listeners and our clients. It has been so effective in helping to manage IBS symptoms, and for our clients to have something that is able to be done from the comfort and safety of their homes is really a game changer. So for that reason, we are extra excited to have Nerva as our sponsor this season. I am so excited for this episode for a couple of reasons. One of them is, again, an excuse I have to sit down with you, but also the topic we're talking about today is very near and dear to both of us, to our clients, and I think to a lot of people who have been unable to find answers to this one very specific symptom, which is dizziness. Dizziness for me, I will tell you on a very personal note, is my least favorite symptom I could ever have. There's something about feeling dizzy, feeling vertigo symptoms that feels so unyielding. And it also feels like I don't think there's anything I can do when this happens. It feels like I just have to wait it out. And I know for that reason, it can also feel extremely triggering for people from an anxiety perspective. So I am extra excited for you to be talking about this today, and welcome back, Taylor.
Thank you. So you're not sick of me yet?
Never. So we're going to talk about dizziness from a couple different perspectives. I think, again, when people hear dizziness, they think, I don't know why this is happening. It's random. And often when they go to doctor's offices, it feels like the feedback they're getting is this is random. Taylor, you're going to talk to us today about how dizziness shows up from a proprioception issue, a vision issue, inner ear issue, musculoskeletal issue. And actually, are you going to tell us that there is hope when it comes to dizziness?
Yeah, there is a lot of hope. And I think you nailed it right on the head. The scariest part about dizziness is how uncontrollable it feels. It's also, in my opinion, a debilitating symptom. You can't really go about your normal day, your normal activity. You can't really push through dizziness in the same way you can maybe push through some muscle aches and pains in that realm. When you're dizzy, life doesn't feel normal. You can't go about your day-to-day life as you usually do. And that is really, really scary. I think another big issue with dizziness is that a lot of providers, let's say, because dizziness can get scary to the point where we end up in the ER or urgent care because it feels so out of our control. The only thing they do is say it's vertigo or it's anxiety. Those are the only two real options. And that's not true. There's a lot of other causes of dizziness. There's also really easy ways to tell if it's vertigo or if it's not vertigo, which we're going to talk about today, that I think if any clinicians are watching this, you should just be asking a couple deeper questions, because if it's not vertigo and you are doing the Epley maneuver, which we're going to define all of this, but you're doing the Epley maneuver and it's not vertigo, that's going to make your patient worse. And we don't want to make you worse when you're already feeling dizzy.
I think when we take dizziness from this big, scary, ambiguous thing into understanding those root causes and breaking it down into this is potentially why, and here's things you can do, it takes a lot of the fear out of it. However, the symptom itself, we know is uncomfortable. It's very uncomfortable, and it feels, from an anxiety perspective, that depersonalization feeling. So when we're talking about dizziness, Taylor, are we talking about in this episode vertigo? Are we differentiating different types of dizziness and experiences someone can have? And can you describe what the symptoms of those types of dizziness might be?
Yeah, so there's two main groups when it comes to dizziness. There's peripheral and there's central. Peripheral means it is coming from your vestibular system. There's something going on in your vestibular system, which means your ear, your inner ear. This is where vertigo comes in, BPPD, if you've heard of that. And the key symptom for this is the room is spinning. That is the question your doctors should be asking, and you should be asking yourself, is the room spinning? Am I spinning? Are things spinning? That is different than central, which is your brain. And that dizziness doesn't feel like spinning. That's the dizziness we hear about all the time in our population, that fuzzy, staticky, TV type dizziness where you just feel almost drunk is how I've had clients describe it to me. That is not peripheral vertigo. That is not coming from your inner ear. And it's really important we differentiate the two because the treatments are completely different. And so when we're talking about our system as human beings, there's three main things that control our balance: our vision, our eyes, our proprioception, which is where's our body in space. And we have proprioceptive receptors throughout our connective tissue, throughout our body, in our muscles, in our ligaments, tendons, and then our inner ear or our vestibular system in itself. When we have peripheral vertigo, so our inner ear, the message is not getting to the brain. So we turn our head to the right and our brain doesn't get that message, or it thinks that we are turning to the left. There's a bunch of different things that can go on. That is different than central, which is your brain gets the information, but it doesn't know how to process it. So your ear said, hey, she turned her head to the right, and your brain's like, oh, there's a bird outside. Like it didn't hear it. It didn't know. And the symptoms are very different. In our specific population, which I assume we're going to talk the most about today, is one of the main reasons for central vertigo can be a lack of blood flow to the brain and to the heart, which is what we normally see in most types of dysautonomia. Now, I want to be clear, dysautonomia is an umbrella term. There are 30 types known right now, probably more, of dysautonomia. POTS is only one type of dysautonomia.
Of 30.
POTS and all the dysautonomia types have a lot of similarities, but they are not the same. And there are differentiating symptoms that make POTS specific, as well as different treatments that are only going to work and help for POTS that aren't going to help for the other types of dysautonomia. And the opposite is true too. We can generalize some treatments like nervous system regulation is going to be good for anybody with dysautonomia. But if you don't have POTS, there are certain medications, there's certain cardiac rehab stuff that we're not going to want to do. Now, when it comes to the dizziness, this is a common general theme in most types of dysautonomia, where it is caused by gravity not being our friend, pulling our blood to our feet, not getting it up to our head enough. And sometimes that can lead to dizziness, that can lead to heart palpitations, that can lead to a whole slur of different symptoms. The other things, there's a lot of things that can cause this central vertigo, but one of the others that's mainly in our population is upper cervical instability, which is when top of your neck, so your skull, your first vertebra, and or your second vertebra, we're kind of lumping them all together now, is unstable. And it can get to the point where those vertebrae move, which is really scary, and can hit your brainstem. As you can imagine, that's going to lead to dizziness. That's going to lead to your brain not being able to interpret information very well.
So if it's cerebral blood flow issues, let's call it, and you're having, let's say, a form of dysautonomia, and we'll probably refer to POTS because even though we know there's 30 forms, we'll refer to POTS here. If it's a POTS-like symptom and your blood flow is dropping to your feet and you get that dizziness feeling in a hot shower or after standing too long, the dizziness is quite literally coming from the fact that your brain has a smaller amount of blood flow going to it. And it's a warning sign, basically, from your brain saying this is happening. So let's talk about also, in relation to all of this, you use these terms that are really, really important when it comes to dizziness, which is proprioception. Tell us what proprioception is.
Yeah, so proprioception is where is your body in space? What happens when we move our arm is we have receptors and our nervous system tells our brain, she just moved her arm. Sometimes that interception can be slower or not happen at all. And your brain is like, oh, she just moved her arm. I didn't know that. This can also happen with our legs when we're walking. That can make us feel dizzy. Or it can make us not be able to walk in a straight line and we appear dizzy, which I think happens a lot in hypermobility. I know personally I get told I don't know how to walk in a straight line all of the time. But also that might make you feel dizzy, even if you are not actually by definition dizzy because you are not able to walk in a straight line. That makes you feel out of sorts. That makes you feel out of control. That would be due to a lack of proprioception.
Tell me also, when it comes to proprioception, why would our proprioception become altered at some point? What would make us not understand where our body's moving in space and how that relates to the rest of our body?
Yeah, so the honest answer, we don't always know why these things happen. There has not been a specific paper defining why this might happen, but there are a lot of hypotheses, especially in the hypermobile population. The leading hypothesis in the hypermobile population is that we either lack proprioceptive receptors due to the laxity in our connective tissue. So there's not enough for that information to get to our brain, or it is a lack of blood flow, a lack of processing, a lack of something in our actual brain that is not computing that information correctly. So there is a lot of different hypotheses on why this might be happening. We don't fully understand why, but we definitely know it is a very, very common theme in hypermobile bodies.
Can that be worked on? Can we work on our proprioception?
Yes. So that's my favorite thing about proprioception. One, it's so easy to work on. You can do it in bed. You can do it sitting up. You can do it lying down. You can do it standing. It is one of the most accessible things anybody can work on, whether you are bedbound or you are not. You can work on this, and it can start really, really small, and it can go a really, really long way. And so you can start with very, very simple, what I call toe yoga. If you just look that up on YouTube, you'll find some things and start there. You can start with just when you're brushing your teeth, standing on one leg. Start with closing your eyes when you're brushing your teeth. Little tiny things can go a really long way when it comes to proprioception. You don't have to be standing on a Bosu ball and juggling and lifting 500 pounds to increase your proprioception. It can start very, very small, and it can go a really, really long way.
So what you're describing is that something happens in your brain when you do two different things at the same time. So when you're standing on one foot and you're brushing your teeth, basically the fact that you're using balance and also focusing on a task, does it activate proprioceptors, which are they nerve centers? Is that how you would describe proprioceptors?
Yeah. So like kind of how in nutrition, like enzymes have their little receptors. Think of proprioceptive receptors like those, except it's for nerves that go to the brain. And so there are some things that make our proprioceptive system more active, and that's actually taking away another system. So if we take away our eyesight, that increases our proprioception. If we take away our hearing, that increases our proprioception. If we do dual task movements, like we were just describing, that can increase our proprioception. Those are the three main starting points for increasing our proprioception that can go a really, really long way. It used to be thought that we had to stand on Bosu balls and all of this stuff. And I actually used to be in that camp a couple of years ago. And we realized it doesn't have to be that complicated. Yeah.
What camps are going on in the chiropractic hypermobility community? You're like, oh, the standing on the Bosu balls proprioception camp. I'm like, no, Taylor, I've never heard of it. Okay.
Hey, you have your own camps in nutrition. Okay.
We do. We sure do. That's a good way of visualizing for people to explain it too, that it's like these receptors and there's things you can do to activate those receptors. And when you do, ultimately the goal is not only for you to have less dizziness as a very long-term result of that, but really it sounds like just also creating balance within your body and understanding within what's my body doing kind of, and connecting the different parts of the body a little bit better.
Yeah. And it's also, in my opinion, about control. As humans, that's all we ever want. And don't get me wrong, part of being a human is learning to let go of control. And that's one of the most uncomfortable things for a lot of people.
Yeah.
But if we can add a little bit more control to our life, I think we should. And if we can increase our proprioception and we're able to walk in a straight line and we're not rolling our ankles all of the time, that's going to make us feel more confident. It's going to make us feel more in control. And that in turn can make us feel better about ourselves, including dizziness and a lot of other symptoms.
If we improve proprioception, which means we're affecting nerve activity, does that also mean that you might be influencing like nerves that control other parts of your body in ways of like where blood flow is going, in ways of like which muscles are being fired? Or are these nerves very specific to orienting yourself in space? That's a complicated question.
Yeah, so they are very specific to orienting yourself in space. But with that being said, neuroplasticity is one of the coolest things. We get the ability to change our brain pathways. We get the ability to change how our nervous system fires and how it responds and how it interacts with us. And I think if we change it in one realm of our body, it can cascade into all realms of our body. Now, I'm not going to say by working on proprioception, you're going to get more blood flow to your brain, because that just wouldn't be true.
No,
but I think that if we work on proprioception, we feel more confident, we're able to move more confidently. That's going to get more blood back to our brain and to the rest of our body. That's going to allow more muscles to fire because we're able to use them more. So inadvertently, I would say potentially, directly, definitely not.
Love it. One major barrier that I see with my clients is their ability to get comprehensive and functional lab testing. I am so excited to introduce our podcast sponsor for today's episode, Inside Tracker. Inside Tracker is more than just a lab company. They help to personally select the exact labs you'll need to have a really comprehensive view of your health. And they will actually send someone to your house to get those labs completed. Once those labs are completed, they will go into your Inside Tracker dashboard, where you will get insights into how these labs are important and what changes you can make based on those labs. The labs that are run are extremely helpful for those who are not able to get their doctors to run every lab that they need. I've been using Inside Tracker with my clients and found amazing insights from their professionals. Inside Tracker also integrates with apps like Apple Watch and Aura. It can also integrate with your DNA testing to give you more insights on that as well. Whether you want to improve metabolism, heart health, cognition, sleep, stress levels, Inside Tracker helps to reveal the exact areas of your health that need improvement. One other barrier I found with clients outside of getting prescriptions for those lab tests is actually being able to understand and interpret. So that's why I find Inside Tracker so incredible. The Inside Tracker scientists have sifted through the research so that you don't have to. If you want to test, not guess, when it comes to your health, save 20% on all of Inside Tracker's plans with my exclusive deal. Go to insidetracker.com/quietthediet. That's insidetracker.com/quietthediet for 20% off of any Inside Tracker plan. You can find this link in the show notes. So really also the question is, what affects one area of our nervous system does not affect necessarily every area of our nervous system. However, whatever affects our brain does affect every area of our nervous system in some ways. And really, when we look at these conditions like POTS and all forms of dysautonomia, these are all dysfunctions of the autonomic nervous system, right? These are nervous system based conditions, syndromes. So it's really interesting because we think that these are conditions of the heart, or we think that these are conditions of something else, but these are really conditions of our nervous system specifically. So anything you do that makes your nervous system feel safer, anything that makes your body feel more cohesive within space, can have that indirect feedback to, I don't have the dizziness symptom. Now I'm having less anxiety because I don't have to deal with the symptom as much. So it's indirect. Let's talk about the vision piece of things with my clients who have POTS. I noticed that they have a lot of visual issues. They can get visual snow, which can kind of feel like dizziness, because dizziness can also feel like kind of feeling where you're just like a little brain foggy or a little bit off, but you can't even really define it. I also have clients with POTS who feel like there are blocks or like blobby blocks in your head. And when you move your head one way, it feels like, whoosh, and you feel like whooshing almost going on in your head. And there's like this heaviness, and that usually accompanies some visual strain, some eye issues. Talk to us about how our vision system and our occipital lobe all relate back to this dizziness piece, and why does this all happen in POTS or dysautonomia?
Yes. So our vision system, if you will, or ocular system is a part of our balance system. The thing about our vision that I want everybody to know, it's very connected to our neck. Our suboccipital muscles, which are the muscles right at the back of the skull, which a lot of people in this population usually get headaches in that area or feel tension in that area, are directly connected to our eyes. When we move our eyes side to side, we should actually feel activation in our suboccipital muscles.
Feel it.
The other thing is that our eye nerves come from our brain. They're part of our cranial nerves. And all of this is going to impact our ability to feel balanced and be upright. And so when it comes to POTS, and before we even get to POTS specifically, there is a lot of things in this population that mimic symptom overlap. Upper cervical instability is going to feel very similar to visual snow and to that head rocking, nodding movement. A CSF leak could potentially also feel very similar to this. Intracranial hypertension can also feel very similar to this. So I guess what I'm trying to say is it might not just be POTS. It might be. There might be other things at play. And that's really when practitioners and clinicians need to get deeper and ask deeper questions. Is this dizziness happening when you're moving your head, or is it happening when you're going from sitting to standing? That one simple question can go so far. If you don't get any dizziness, no symptoms from moving your head, but you get dizziness from going from standing to sitting, it's probably orthostatic in nature. It's probably dysautonomia.
It's more of a potential blood flow piece as opposed to a cranial nerve piece. Also, you even doing that to show what happens when your head goes side to side just made me dizzy, and I'm laughing because I'm not even the one doing it. But people can also have both sources. That's why it's so important to start writing. When we have dizziness, Taylor, and you know this, personal experience, client experience, it is so alarming and so frightening. I think that we think it's this huge blob of like this scary thing. This is my life. This is forever. We're kind of told also in the medical, I guess, like society or culture, whatever, that dizziness is permanent, and dizziness is something that like is just your brain, and too bad. And unless it's vertigo and you can get a vertigo medication, there's just not that many options for people. People will try like acupuncture. They're like, maybe it's a migraine, so I'm taking, migraine medications. But I think people really feel like, again, this such ambiguity around it. So I think isolating your own symptoms, if you're listening, and just saying, you know what, it is worse when I move my head like that, or it is worse when I get up from sitting to standing, then you can start to see little strategies or little kind of things that you can notice based on that. So that's what I would tell people to do kind of first, is try to identify, is this vertigo? And that would be through a practitioner. Or is this, if I'm having dizziness, where are my symptoms mostly coming from? Because that'll also let you know if you do need a practitioner, what type of practitioner you're going to want to go to. Because if it's more of a situation where it's going from sitting to standing, you're going to want to go to someone who is probably more of maybe a dysautonomia specialist, or someone who does matters of blood flow in the heart, interventional cardiologist, if you want that support. Versus if your dizziness is going when your head's moving left to right, you might need to get x-rayed or scanned, maybe in a PT's office, a chiro, or someone who specializes in hypermobility potentially would be really helpful.
Yeah. So just to summarize everything, because I know it can be kind of confusing, the 3 questions that can be a good starting point to ask yourself: when I feel dizzy, is it the room spinning, or is it more of a staticky, weird feeling in my head? If it's the room is spinning or you are spinning, that is more of a peripheral vertigo, and pretty much any practitioner can help with that. You can also look up Dick's Hallpike maneuver as well as the Epley's maneuver. And if that helps, that is more confirmation that this is peripheral vertigo, which is extremely unpleasant and uncomfortable and scary. But luckily, there is a lot we can do for that. And it is very non-invasive and usually quick too. In comparison, if it's not the room spinning and it is the next question to ask yourself, is this happening when I'm moving my neck? Is this happening when I'm going from sitting to standing? And based off of those answers, and it might be both because two things can be true at the same time, then finding somebody who specializes in upper cervical instability and or dysautonomia, usually a neurologist. Every now and then you will get a good cardiologist as well, or vestibular PTs can help with this. Functional neurologists can help with this. Chiropractors that specialize in this can help with this. So there's a lot of people that can help with this specifically. And luckily for both of these, the treatments and the management options are pretty non-invasive. So I think one thing about upper cervical instability that gets scary and confusing is it seems like surgery is first line option.
Yeah.
It's not. 5% of everybody with upper cervical instability are surgical candidates. That is a very small amount. And it is solely based off of symptoms. And the main symptom to know if you are in that severe category is, are you having cognitive changes? That is different than brain fog. This is, you don't remember your name. You go to your friend's house and you don't know where you are. True cognitive changes, that is a red flag that we need to get looked at immediately. The rest, the dizziness, all of that stuff can improve when we improve our stability, when we improve our proprioception, when we create safety in our nervous system, when we create safety in our own body, when we're able to hold our neck up more, when we're able to get more blood flow to the brain. It can all improve, especially with upper cervical instability. And I really, really want people to know that.
In addition to that, hope, I will also tell you that not only can Taylor, and any amazing practitioner that Taylor trains to be an amazing practitioner, help with that when it comes to at home. If you've listened to this podcast before, you know my approach on this. It's really about, dizziness is a lot about being as non-reactive to it as you possibly can, because dizziness, if it is coming from blood flow issues, anxiety, something like that, dizziness will beget more dizziness if we do not become non-reactive when it happens. So just as a language switch, when you're experiencing dizziness, and I know this is a big ask for me to ask people. However, I think, again, in the past, when I've had dizziness prior to me getting what I need to do from a limbic system perspective, I would immediately go into a fight or flight state and be like, oh my God, why is this happening? This is so scary. This means something bad's happening. I want to go get an MRI. I want to go do this. And but everyone's welcome to get an MRI. Go to your neurologist anytime you need anything, obviously. I think now when it happens, I'm like, I notice this weird symptom. Let me review what's been going on with me recently. And every single time I've ever had dizziness, it has always passed. And I know this is temporary. I know this will pass again. And it's just give yourself that compassion in that moment. Instead of jumping into the, what can I do to fix this right now? Jump into a little bit of acceptance, leaning into it, breathing into it. You can totally say, I hate this and it sucks. It totally does suck. However, it is always temporary and it will always be temporary. So you'll always make it through it. So just from a dizziness perspective on that end, I had to mention that. So that's really important for people to know. There's things you can do physically, some of the tips Taylor's talking about to increase your proprioception. And now we're going to talk about the vision aspect specifically. It's really interesting. We have had the amazing Alyssa Chang on the podcast before, who talks about how our visual system and our nervous system is very interconnected too. Do you notice, Taylor, when with clients with dizziness, that the vision will be more of a warning sign that dizziness is coming, like the vision changes, or because that's a little bit different than the dizziness, because they're also having the visual snow and different things happening? Or is it more you have dizziness over a long period of time and then you notice the vision issues? Tell me about what that pathology and what that process looks like for people.
Yeah, so I usually see it as a warning sign. And let's talk a little bit about warning signs versus triggers. So warning signs is something your body shows you and is saying, hey, we're going to be symptomatic soon if you don't do something. So when we get a warning sign and when we can learn our warning signs, blood pooling is also a good example of this. You look down at your feet and you see that your feet are super, super red. That's a warning sign. That's your body saying, hey, I'm not getting enough blood to my brain. Can we do something about this? We can be proactive in that situation. And so when it comes to vision specifically as a warning sign, if you start noticing, and most people really get triggered, which a trigger is something you do that you know brings on symptoms, and we're going to be reactive in those cases. And a very common trigger for this population is driving or being in a car. And that has a lot to do with our peripheral vision system, as well as our proprioception, as well as not feeling in control when we're in a car, as well as our positioning with our neck and having to be upright for a long period of time, and blood flow and vibrations and loud noises. There's a lot of reasons that driving can be a trigger. But one of the biggest warning signs that a lot of people experience, especially in cars, is they will get that visual snow, or they will get blurryish vision, feeling like you're in a cloud, like there's smoke in your eyes. That is a very common warning sign that, okay, I might be getting dizzy soon. And there can be very different reasons for that. But I would say in the car specifically, that is most likely from an overload that your visual system and peripheral vision specifically just can't handle at the moment. And we can train our visual system like anything else. We can do eye movements if that is one of the parts of your puzzle piece. And that can help, as well as getting more blood back to our brain. But the vision system is very interconnected with our nervous system. I mean, it's part of our nerves come from our brain. They go to our eyes, everywhere else in our body. Our brain conquers all. Everything we tell our brain, it remembers. Our brain controls everything. That doesn't mean things are in your head, but it does mean that we have to work on our head in order to feel better.
100%. Yeah. When you say warning signs, I think what I've experienced myself, honestly, is it's like almost 3-step process. So if I'm doing something that's very physically exertive, or I'm nodding a lot, which, wow, does that happen to my job? Because my face is an inch from the computer listening to people, and I'm nodding my head a lot. The first thing that happens is I'll get some heat in the back of my head in that suboccipital lobe, like you were saying. And then I'll start to get a little my eyes want to close kind of feeling. And then the dizziness starts coming on. That's common. I see that a lot in clients too. And I also see it going different ways. Sometimes people notice the vision thing first, but feeling the heat down there, just also something that can help. I think that's just an at-home something, is that Taylor, you're a huge proponent of this, but icing your neck, so beautiful for the vagus nerve. In addition to literally just bringing some juicy blood flow there, cold will cause more vasoconstriction. So a big piece of dizziness is also histamines. Histamines end up being a huge piece of this dizziness puzzle. Can you tell us how histamines are related to dizziness also?
Yeah. So histamine, in my opinion, is the mother of all the things. In my opinion, this is not backed by science, yet. But I have yet to see any of my clients not have some level of quote unquote mast cell issues, if you will. And so histamine, mast cells produce more than just histamine. And I know you've talked about
thousands of mediators. Yeah.
Like so many mediators. Histamine is just the one that we talk about the most. But one of the mediators that it does produce is something called elastase, which basically, if you have too much elastase, your ligaments can become more laxed. This can be very problematic in hypermobility specifically, especially if that happens to be in your neck and that makes things more unstable. Now we hit brainstem, now we're dizzy. That's a very oversimplified version. Another thing that can happen is our blood vessels themselves are wrapped in connective tissue. They can become stretchy. When our blood vessels become stretchy, that can lead to less venous return, less stroke volume, less cardiac output, and gravity becomes not our friend anymore. That's when we get that blood pooling, and that's when our heart is trying really, really hard. I need blood. I'm going to pump really, really, really fast. You get those heart palpitations. You're now feeling like you are being chased by a tiger. Your sympathetic nervous system is on high alert because it feels threatened, and symptoms come after that. And so if we can stop it at the warning sign of, oh, I see my feet are really, really red, I'm going to lay down with my legs above my heart, get some of that blood back to my brain, or I'm going to put compression on. Abdominal compression is better than compression socks if possible, but I totally understand that since I personally can't handle the abdominal compression, so I get it. But if we lived in a perfect world where we didn't have any weird sensitivities, that would be ideal. But these are really easy things that anybody can do at home. And so if you look down at your feet and you see they're really, really red, lay down, legs up, 5 to 10 minutes, maybe hum to your favorite song, do something for your vagus nerve, put ice on your chest, gargling water can be helpful for this as well. All of this stuff is free as well, which I love. I think that we have commercialized the vagus nerve way too much, in my opinion. A lot of the stuff that we can do for the vagus nerve is free. Laughing helps the vagus nerve. Like I said, singing, humming. Exactly. That's a tangent, but go get some compression and use it. Yeah, or ice, free.
Literally. So when it comes to histamine specifically, elastases, these mediators from our mast cells, histamines induce something called vasodilation, which I'm sure if you've heard me talk about anything, you've heard that word come out of my mouth at some point. But basically what they'll do is widen our blood vessels so that it's for a robust immune response so that our body can get nutrients, immune cells, everything it needs to a site of injury, essentially. So the result of that ends up being when we have constant histamine activation, constant mast cell activation that results in histamine output is that we have constant vasodilation. That's actually what can lead to those leaky blood vessels. And that's what can actually lead to all that blood pooling, because if our blood vessels are wide open, they're not pumping. And we need that vasoconstriction to make blood pump, which, as we've talked about, can be a problem when it comes to really like 2 types of these dizziness, which is if you're not getting good cerebral blood flow, that's one cause. Also, if you're not getting blood flow to your occipital lobe, which then is going to influence your vision, that's another cause. And if you're not getting blood flow to your heart, actually just your heart pumping really quickly can also be dizzying to your body as well. Do you know the mechanism behind that? Or is, because I know that feeling, and it's not only from the lack of cerebral blood flow, it's also when your heart rate's high, you get dizzy too.
I think it's the same idea. It's that the heart rate is actually, the beating heart rate is a warning sign, if you will, telling your body that you're not getting enough blood. But also our blood volume and our adrenaline chemicals are like opposite. So if our blood volume is low, our adrenaline chemicals are high. So norepinephrine and epinephrine, which I can never pronounce, they're opposite. And that, if our adrenaline chemicals are really, really high, that can also make us feel dizzy. That can also make us feel out of control. So that's definitely part of the picture here as well.
Yeah, let's talk about like the case of like someone who's having really high cortisol, hyperadrenergic POTS, and that experience of dizziness, which is like even it's like a zingy dizziness, but certainly adrenaline and those other stress hormones and neurotransmitters can make us feel dizzied as well. Are you believing, and this is a little bit speculative of us just going through the mechanisms, but do you believe that comes from those hormones themselves and the effects that they have, or it's literally because they're causing the changes in blood flow and heart rate?
Chicken or egg? I don't know that I can answer that. I think it's chicken versus egg. But on this topic, let's talk about the different types of POTS, because I don't think it's talked about enough. So there's 3 different types of POTS: neuropathic, hyperandrogenergic, which is really hard to say, and hypovolemic. Hyperandrogenergic is not that uncommon, in my opinion. I've seen way more than I expected to see. And I think that it is on social media not talked about a lot, or you'll never see that type. So don't worry about it. And it does drastically change our treatment methods, because we can no longer use salt in this specific population. So for the hyperandrogenergic type, they actually have high blood pressure, which salt can make that worse. And so we have to find other ways to figure out how to help this population. This population usually also isn't from not lacking blood flow and to the brain. It is the opposite, and they might have too much of something. This is where we can see intracranial hypertension more commonly as well, which can be another cause of dizziness, another cause of visual snow and those weird visual symptoms.
I have to add to how important what you're saying is here. You could have the same symptoms from high blood pressure and low blood pressure.
Yes, exactly.
And in the brain too. So that's what's complicated about it. The one thing I want to add about hyperadrenergic POTS though is that oftentimes people will have high blood pressure or high heart rate, and there actually is a trigger of low blood pressure and low heart rate, and they're not realizing it too. So the salt is like more selective timing wise, because when it comes to your adrenaline at all, when it comes to your adrenal glands, we do actually require more salt in times of stress. So you need to replenish it, but you can't do it when your blood pressure is already high. So it's a really interesting and fascinating piece of this in something like hyperadrenergic POTS, because you're also having potential symptoms from low blood pressure, high blood pressure, and it can vacillate. So you really have to, that's where you really have to actually have a blood pressure cuff and actually know when it's your time to compress, when it's your time to get that cerebral blood flow, and when it's time to actually do the opposite.
Yeah, and there's actually a really cool device coming out. I think it's still like a year out. It's not anytime soon, but it's called STAT, and it's a little thing you put in your ear, and it will tell you when you need more blood to your brain. And the research they've done so far looks so promising. And I think for specifically hyperandronergic POTS, this is going to be a complete game changer. I think it's going to be a game changer for everybody, but specifically that group of people, I think this is really going to benefit them. And I am so excited for that to come out. And if anybody wants to be like a test trial, they are running trial periods right now.
So 100%. And I think, again, so it's really interesting because in hypovolemic POTS, you're having low blood volume, right? So you're having that inability to get that blood flow to the brain. It's really like dizziness comes down to what we're kind of, if we're looking back on our conversation and I'm reflecting on it as we're talking, it comes down to where's the blood flow? Where's the nervous system acting? Where does your body know where it is? Essentially, it's like those are kind of those components of it. So for some people with dizziness, honestly, salt and compression. The reason that these are recommended for POTS is the same reason they'd be recommended for dizziness in many people, but not everyone. As we said, they can help with that blood flow. Taylor, before you mentioned abdominal binders, so I'm going to tell you, because this is not a thing that I knew about before either, but it's basically like, it looks like an ACE bandage essentially, and you wrap it around your waist, and very simply, it helps to push blood flow back into your heart. If your body's having a hard time getting that, like you said, venous return and that blood flow back to the heart. Same thing with compression socks. If you see, me and Taylor and mine are like granny compression socks. Taylor's are like cute compression socks. But if you see
like
that's
with flowers.
Yeah, exactly. Yours have like adorable flowers. But the goal is to create juicy blood flow. That it's a symptom manager. It's not fixing the problem, which is the problem is that your nervous system's telling the wrong parts of your body where to send blood flow. That's more of the thing that's happening, or you don't have enough blood volume, or your body's responding with stress or whatever it is. But in total, what you're really wanting to do is find out what are my specific triggers for dizziness. What are the pathways that are making the dizziness happen in the first place? And then you'll know, based on like all of the tools we just talked about, little things you can try, because there's days where my dizziness might be coming from the back of my head, and some days they might be coming from me standing up. It can be all different triggers and reasons. So it's really about finding out and knowing that there are so many specific reasons why dizziness happens. And this also kind of is similar to why headaches happen, and some of the kind of common triggers of why headaches happen are actually very similar to why dizziness happens. The different ways to kind of look at or start a dizziness journey are to think about, like Taylor said, those 3 questions you would be asking yourself. If you're working with a practitioner, making sure they're asking you those right questions. If you're identifying it as vertigo, it's a completely different treatment plan than if you're identifying it as dizziness. And then thinking about also, is this more of an issue with blood flow? Is this more of an issue with something going on in the back of my head? Is this more of an issue with upper cervical instability? And that's how you can move from there. But the most important thing of all when it comes to dizziness is understanding that your symptoms are not random. It's your body trying to communicate something with you. And there's almost always something that you can do to either make the symptoms better, work at the root cause, or to experience them as less scary. And I think that's what's really important too, is that the actual coming with non-reactivity, oh my goodness, is this hard, can actually be one of the most profound supportive tactics for dizziness overall.
Yeah. And I just want to reiterate that we are only talking about a very small group of the many things that go on in the dizziness realm. But for the hypermobile population specifically, or anybody with a connective tissue disorder, these are the most common things that we experience. There are a whole slur of other things, especially in the vestibular world, that peripheral type of vertigo. So if this is like, oh, I'm not really relating, I don't know if I fall into this, you might be in a different camp of dizziness. And I highly recommend looking into the vertigo doctor. She's amazing.
Yeah. Thank you so much, Taylor. This was exactly what people need. I really want people to just hit home with the fact that dizziness is not this random big blob of a thing that is unfixable, that is untouchable. There are so many things we can do. And because we gave so many different pathways and different pieces of information, I'm going to leave us with that. Thank you all so much for listening, and thank you for coming, Taylor. You're the best.
Thanks for having me.